We weren't talking or anything just a couple
Hi.
minutes ago.
We were having a whole conversation as if we were being recorded and then realized we hadn't started it.
Oh my God. How's it going?
Hi, it's so
Hi.
good to see
Hi.
I'm just so grateful to have Dr. Monica here. You have been such a gift to so many people with senior pets and who are facing the anticipatory grief that comes with the end of life decision making. And we're just so grateful to have you here. So I'm going to have you introduce yourself and then we'll dive in.
Yeah, so thank you guys so much for having me. And I've been looking forward to this for months now. And we had a lot of really great questions, so I'm excited to answer those for you. So I am a veterinarian. I am a general practitioner. I live over on the East Coast in the Washington, D.C. area. And I've been practicing for about 12 years now. When I was in vet school, I had kind of not a super unique experience, but unique for me at the time. I had my very first soul dog become a senior. So he was a little Westie named Frodo Baggins Tarantino. And I basically was in this really odd situation where I was surrounded by the brightest minds in veterinary medicine, but then also watching my dog go through their senior years and struggle. So Frodo was this really healthy dog up until he hit age 10. And he went from being a dog that was never in the animal hospital to a dog that I couldn't keep out of the animal hospital. So he had a chronic bronchitis cough develop that really affected his health. It almost took him later on. He had neck pain. He had a mass in his abdomen that ruptured. He had all these different things that popped up. And I remember just struggling and feeling like I didn't have enough guidance in relation to how to care for an older animal. And so when I graduated vet school, I moved to Charlotte, North Carolina, and I decided that I was going to take my time and like get good at medicine first, and then I was going to do something different for senior pet parents. And that's when about 5 years out of vet school, I started a podcast. I started my social media account. I started Pet Loss Community with Dr. Lisa Littman. I'm sure you guys know who she is. She's phenomenal. And I really just started talking about this journey that we're on. If you have an older pet, you're really on this journey with them and the different types of challenges that you can have and how you can overcome them, how you can navigate them, how to best care for these guys when they're the most precious thing to you in the world and you know that your time is limited, and really trying to figure out ways to do that. And so it really became a big educational platform for me. I then also co-founded the Senior Dog Veterinary Society, which we co-founded about 2 years ago. And the idea behind that was online, my account really grew really big. And I kept having a lot of pet parents come to me and be like, we just want to find a vet that loves old dogs. You know, like, we don't feel like ours does. Like, we just find one that loves them. For me, on my side, I'm like, oh my God, so many vets love old dogs. But the problem is that we're not talking about it. We're not doing things different for them. We're not being accessible to you guys as we could be. And so we formed Senior Dog Vet Society, which really focuses on providing the latest geriatrics training for veterinarians, and then also has a directory where people can look up in their area vets that are interested in geriatrics and take additional geriatrics education every single year. So you can find basically a senior dog certified vet. And really all that says, it doesn't mean they're a specialist, they're not, but it's just someone that has such a sincere interest in caring for older animals, that they do things differently. They're up to date in the latest, and they're hopefully going to be able to meet your needs as best as possible.
And where can people, when I send out this full episode, I'm going to put all of
Yeah.
these links and resources because I'm sure we're going to mention a lot. But for what you just said, what people could search for a certified senior vet, what was that website where they could search for that?
It'll be at seniordogvets.com.
Okay.
So really simple. And there, you'll see an online directory up there. And we have over 700 vets that have already joined. I think we have over 550 that are certified already. And we just started it like 2 years ago. So there's really a big interest in it, and there's a need. Like,
Yeah.
there's a big need because we don't really get traditional geriatrics training in vet school. You know, I never had a geriatrics class, and yet they're literally our most complex patients that we see out there. As you guys know, owning older dogs, you're just like, yes, they've got a lot of issues that can come up for them. And
Yes.
so we wanted to open that conversation and really bring attention to it.
I think it's so fascinating, just as an aside, that you didn't have specific geriatric training in vet school because it's such a huge part of the population of animals that you're going to be taking care of. That it's kind of like we're having such a menopause moment. And that's also an area of training that, doctors don't have. So
Yeah.
there's such a correlation there. Thank you for setting
Yeah.
what you've done is incredible. So
Yeah, of
the
course.
top question that everybody asks, what is a senior pet? What is a senior dog?
Yeah, I think it's a really good question, and it's really confusing because there really isn't an official answer. But what I like to tell people is that senior pets are dogs that are tend to be in the last 25% of their life. And so certainly for breeds like golden retrievers, we consider that at about age 7. That really is a great age to start thinking about them as a senior, even though they look amazing. They don't act like a senior. You don't feel like you're seeing anything that quantifies them as being a senior. It's really great to start thinking about them at that point. But it really is a point in their life where it's supposed to be the equivalent to us being around 65 years old. Like that's really what you're going for with it. I would say that for pets, a lot of when they become senior will depend on the size of the animal. So smaller breed dogs, they obviously live longer than larger breed dogs. And so they tend to become seniors a little bit later. So you might say age 9 to 10, maybe even 11 for some really, really small dogs. And then you can honestly have dogs that are like giant breed dogs become seniors even younger at about age 5 or so because they've got a much shorter lifespan. And so it really depends, but the just a great age to kind of use for a lot of like retriever sized dogs is what I would say is age 7 for them.
And what, I mean, I'm just wondering if you can just give an overview, like if someone comes into your practice or you're seeing a dog who is about 7. Okay, for example, I just took Harper in for her annual exam, and there was a new vet that doesn't know her, and she's 10 and a half years old. And I was surprised that we didn't discuss anything about her being a senior. And there weren't questions about her that I felt applied to her being a senior. So I'm curious if that happens for people, what is it that we want to happen with our vets in an exam, or what do we want to be thinking about for our dogs at around 7 years of age so that we make sure that we are taking as good a care as we can heading into that last 25%?
Yeah, I mean, I think it's a really, really good question. This is a brand new recommendation. So a lot of vets aren't doing this yet, but they will. We'll catch up with it. But there is a brand new senior screening wellness checklist. And essentially all it is this one-page form. I created it, and it's a one-page form that looks at different areas that are really important to seniors as they get older. So dental pain. Seniors need to have dentals just like the younger guys do, if not more. It's just more important to their health with the organs it can impact, with the disease it can cause, with the chronic pain it can cause for these animals. Joint pain is another big one. We ask about mentation, so being aware of the various signs of doggy dementia, which there are a lot of questions that you guys submitted on that as well. We can talk about that in a little bit. Certainly mobility, and if that's being impacted, you're really looking for subtle changes. So sometimes it's as simple as they stare a little bit longer at the couch before they jump up onto it, right? So you're looking for just subtle behavioral changes with seniors. If they have a change in their elimination, so they have urinary incontinence, we had a question about that as well, or they're frequent to have messes in the house, or we had another question about bowel incontinence for a dog that you guys had submitted as well too. So any instance of incontinence, people actually don't bring up incontinence at the vet for about 2 years until it's actually 2 years into it. People don't tell us unless we're asking for it. So it's really important for us to be aware of that because we can intervene a lot sooner with it. And then things such as changes in their senses, so decrease in their vision or decrease in their hearing. So those big things are things that I think about with them. But in particular, the biggest like overall topic that I think about for senior pets is going to be chronic pain and then cognitive decline. Those two things will truly have a huge impact on a senior's quality of life. And at first, when changes start off, they often start off very subtle. And the only way that seniors and animals really have to tell us that something is changing or something is different for them is truly behavioral changes. Mm-hmm. So they often start with very subtle behavioral changes. And I think honestly, and there's been studies on this, that pet parents are the ones that are the best at picking up on them. Because at an animal hospital, their adrenaline is going, you guys know the pets the best. And sometimes even if they have chronic pain, they're not going to tell me on a physical exam. So really it's a lot with the changes you guys see at home. So the two topics I think I'm most passionate about because of their huge impact on seniors is chronic pain and cognitive decline.
Okay, I have questions on those two, but I want to go back real quick first because you said dental. Well, first off, the sheet you referenced, is that available online anywhere for people to print out and take with them?
You know what? I'm so glad you asked me this. I was thinking about this other week because it's available for veterinarians to download, but it's free online to download it. But I think that I probably need to make it accessible to pet parents so they can bring it in and be like, hey, I found this form online. I filled it out. I just wanted to give it to you. And they're like, oh, what is this? Because it takes, for whatever reason, with the vet, even if I'm out like every single conference talking about this, it will take a few years to really get to everybody. So I think certainly giving it to pet parents. So I will make it after this.
And you said a dental. So when I took Harper in, I said, I really think she needs to have her teeth cleaned. And he agreed with me. But I felt like that came from me. And,
Yeah.
people, I posted just as an aside, oh, Harper got her blood work done for a dental. I didn't think, you know how this is. You'll post
Yeah.
something and it's a firestorm. And the
Yeah.
number of DMs that came back, what do you mean you got her blood work done? Why is she getting a dental? Is something wrong? Does she have pain? And I realize people have no clue about dental care, but specifically seniors. So when you say a dental, what are you referring to, and what age typically should that begin as part of the care of our dogs?
Yeah, no, it's all really good questions. It's funny when I talk to clients, they're like, we've had dogs forever and no one's ever told us about this. When I bring it up and I recommend it. And I'm like, I know, because it's just like, it's because one, we have more and more studies that show just how beneficial it is to have a decreased bacterial load in their mouth, and just how much chronic pain can be attributed to it. But so when I mention a dental, what I talk about is a dental cleaning that is under full anesthesia. And the reason why it has to be like that is because you cannot clean below the gum line, even in the best behaved animal. You cannot clean below the gum line or see what's happening below the gum line with an awake dental cleaning. It's funny too, is a lot of people, they'll be like, I brought my dog to get groomed at like Banfield, and they'll elect a toothbrushing during the grooming session. And then I'll ask in the exam, I'll be like, when was the last dental? They'll say, well, they just had it done when they got groomed. But that's not a dental cleaning. Having their teeth brushed is not the dental cleaning. The dental cleaning is a full anesthetic event where we actually scale the teeth. We take dental x-rays of the teeth, looking at the roots and examining the bone structure there as well, and making sure that is all intact and that there is no evidence of diseased roots that are painful that your pet can't tell you about. No evidence of inflammation. We look for oral masses really well when we go and we intubate them and we palpate. And you will be surprised at the amount of rotten or diseased teeth that you can find on a dog that seems perfectly fine at home, is eating, drinking, wagging their tail. Or it is honestly shocking for a lot. I've done dentals where I'm like, okay, this is just gonna be a prophylactic cleaning dental that we do under anesthesia. And then we get in there and we take the x-rays and we see that there is eating away of the bone around the roots, because underneath one tooth, and this dog has been living with it, and we don't know, the owner's like, oh my God, I feel bad, I don't know how long they've had that, and we don't know how long they had it. But the idea is that you'd want to have a dental cleaning done every single year, annually, under anesthesia for most dogs. And people will recommend, boarded dentists will recommend starting as soon as age 1 or 2. I think it really depends for me on the dog when I start it, but it's really equivalent to the idea of us going in every 6 months and getting our teeth scaled and cleaned and x-rays and checked out, because it's just so important to your health and to your ability to function and to eat, and to eat without pain, truly.
I know I'm going to hear back on this, because I've never heard that. I've never heard that we should do it annually. So
yeah,
really a big eye opener. And so obviously then when they're 7 years of age, if they've never had one, schedule it.
I would schedule it. Yeah, absolutely. Because you just don't know what's in there. But I think the issue is that a lot of large breed dogs, those teeth look pretty white, and you don't see a lot of calculus. So a lot of us as vets, we're like, I mean, they just look so good. And so you kind of try to, I think with medicine, you try to balance this practical take an experience that you have with what the actual recommendation is, and be like, okay, for this pet, the recommendation is every single year. So should we be doing it every single year for them? And you might just wait a little bit longer because you're like, they just look so good. And but I do think for sure, if you have not had a dental in your dog by age 7, you should, because we'll find surprises. And even if we don't, it's still good for us to go in there and clean below that gum line and to double check and to make sure there's no sources of chronic pain. Because the worst thing to me is this idea that they had some diseased teeth here and had some pain for a long time, and they couldn't tell you. They just tried to adapt as best they could with it. And animals are just so resilient. They will still eat with rotten teeth in their mouth. They'll swallow kibble. Like I see dogs that have had like full rotten teeth, not that I do, they'll still swallow their kibble and they'll have like one or two teeth on one side that don't hurt as much that they'll crunch with it on. So then someone just thinks they're like, oh, I hear them crunching and eating their food. They don't have pain, but it was just these two teeth in their
Wow.
whole mouth they can crunch
Mm.
on. So
Yes.
We have quite a few questions around anesthesia and
Yeah.
safety, and what if my dog's too old, and like, what are your recommendations or your thoughts?
So the big thing with general anesthesia is most seniors do really well with anesthesia. Even ones that you look at, you're like, there's no way. Most of them are still going to do really well with it because we're going to know in advance, as long as we're doing things in advance. So the way to create the safest anesthetic procedure for your dog for a senior dog, is to make sure you do the workup in advance to check out the things that need to be checked out. So the blood work. And I have this personal recommendation, and one of my mentors is like, Monica, this is ridiculous. You should not do this. But this is my thing that I do because I've gotten burned twice now, once with a client's dog and then once with my own dog. And I take x-rays. I'll do a set of chest x-rays before I do an anesthetic event on an older pet that's a large breed dog that's age 10 or above. Why? Because that's a place that cancer likes to go to. And I want to know before I do that whether or not there's cancer there, because that might stop the $1,000 whatever dental that we're going to do, and might have us pivot for a second and kind of try to redecide. So the point being that the way to create the safest anesthetic event for a senior, and most of them are going to do really well with it, is to do the blood work and then do whatever it is your doctor's recommending. So if they have a heart murmur and they recommend going to see a cardiologist, go see the cardiologist beforehand. Just like get all your ducks in a row before you go, and then help take care of that chronic pain in that animal's mouth. Because it's actually, if they have heart disease, it's better to get rid of that bacteria and that diseased teeth in their mouth, because that can affect their organs internally as well. Even dogs with diseases like Cushing's or diabetes or hypothyroidism, they all go under anesthesia with us. But the idea is that you have to, once we get the information in advance, I can prep for it and I know exactly what I'm going to do with it. And for me, and we have a lot of training that we have in senior dog vets, but for me, when I have older animals, it's the entire team on board. We're rounding ahead of time. I like to have a 1-to-1 ratio. So you should ask your veterinarian this, be like, what's the ratio of technicians or monitoring for my dog while they're under anesthesia? And you should have one person that's literally watching them it's not, they're kind of here, kind of there. There's like multiple things going on. It's like this animal is our entire thing from the time that we induce them to the time that we are recovering them and they've woken up, and we're kind of watching them afterwards. And so, but most of them handle it pretty well. I can't say like if your vet's recommending not doing it for 1 year, like I think that's a decision between you and your vet for sure. But I will say one of the things that is, I think, soul crushing for pet parents and vets alike is if we delay doing the dental for year after year. We go into our wellness and like, no, not this year. No, not this year. No, not this year. Maybe next year though. No, not this year. And then you have an animal that's 12 or 13 and now they've got a heart murmur and now they've got a sore neck and now they've got whatever other disease they've got. And then this heart murmur that they've had has been getting worse and worse and worse over the years. And now it's more of a risk now than it was if we had, like 2 years ago or whatever, when we were talking about it. And so I do think being mindful of putting it off, because that's really easy to do, just not going to make a decision, right? And that not making a decision is a decision.
Yes.
Right. And
Yeah.
so
And it is really, even when I made that appointment for Harper, she's still so healthy.
Yeah.
Like I want to take advantage of the health that I'm seeing in her.
Yeah.
Do all the things that can help support her so that when we get to 12, when that big decline really starts to happen in Goldens that make it to 12, right? 12 to 14 it's a whole new ballgame. So I want to support her and be really ready, hoping to 12 to 14. So that was part of my thinking.
Yeah, no, and it's really smart is doing it when they're healthy and they're feeling good. And I do think if you have a vet that's reluctant, some vets I think are more reluctant to do it. You can always get, and you're like, but I think they need it. You can always get a second opinion from someone. You can also see, we do have boarded veterinary dentists in the country, and they're fantastic. And when I think about doing anesthesia on, every patient, but in particular seniors and geriatrics, our team, we're like, look, here's the deal. We're going to get them down. We're going to do the thing we need to do, and we're getting them up. Our goal is the shortest period of time for us to take care of whatever it is we need to take care of and recover them. And that's literally what we do. Vicky's asking, do you have any concerns about anesthesia side effects? Vicky, so like they're always groggy, right? The next day when they get home and they're groggy the next day. I personally think seniors take about 24 to 48 hours to kind of get back to where you're like, okay, they're doing their thing or whatever. But I don't really get too concerned about it. We have a lot of really safe anesthetic agents that we use and drugs that we use for animals. And so I don't get too concerned, but I know what to expect. And that's the biggest thing is you have to know what to expect. But we have a lot of safe agents that we use these days for anesthesia.
Okay, so
That was good.
yeah, you had said your two passion points, mental, well,
Chronic pain and cognitive decline. Yep.
yes, I want to make sure we get to those.
Yeah.
Chronic pain, because I think you touched on a little bit about how they communicate with us. I am micro aware of everything, especially that my seniors are doing. I think all of us are like that with our dogs. But Rufus yesterday, he was looking up at me and he lifted his paw and I'm like, are you lifting your paw? Why are you lifting your paw? Is your paw hurting? Well, no, he was just like, but right, but we're watching.
Yeah.
But talk to us about how we can, two things. One is how we can support them and keep them healthy so that we minimize pain in their senior years. And then once we begin to see pain, what we can do to support them.
Yeah, I think the most power that you have, cards are in your favor because you are the one that watches them the most. You know them the best. So you literally know what is normal for them. And then when you start seeing different shifts in behavior, that's going to be a clue and something to bring up to your vet. But the best thing you can do is be aware of point one, where the most common places that we can have chronic pain in pets is, and the two most common places are going to be their joints, very familiar for golden retrievers, and then their mouths. Those are the two most common places. Now, there are other sources of chronic pain, like certainly like GI reflux or GI disease, like chronic gastrointestinal disease that's not controlled, can be cause visceral pain for them as well. And then another thing worth mentioning for Goldens is that you can also have chronic pain with like skin. So if you have a chronic ear infection that you can't get rid of, or it starts closing off and they need like a surgery, like a tikaboo, which is just like they remove the entire ear canal essentially for a pet because they can't get rid of the chronic infections, whatever it is for the anatomy and the genetics of that dog, you can't get rid of it. But those are also sources of chronic pain as well. But the two most common places that you should be aware of is teeth and then skeleton. That's it. And the signs to be aware of for animals, especially Goldens, is going to be things like being slower to rise. So you just notice it takes them a little bit longer slower to rise. Of course, a limp is going to be something. I think not going on top of the bed or the couch like they used to, like maybe they sleep more on the floor now. That could be also an example of that. There are certainly things such as like if they have difficulty posturing to potty. I think someone mentioned this before. They've said they are having difficulty defecating normally now. They just kind of go all the time now. And it can be difficult for some animals that have got bad hips or bad knees to actually get into that position to defecate. And so that can be an example of it. If they fall or they slip more easily, that can be really common for them as well. And then things such as stiffness, or they warm up, of course, as the day goes on, or lagging behind on walks. Those are all classic signs. If you, as a pet parent, though, you find yourself saying things like, oh, they're just slowing down, or they just don't like this as much as they used to, something as simple or subtle as that could also be a sign too. And what I would ask for would be when you go in for your wellness visit is mention what you're seeing and then ask if they can do a really good orthopedic exam, just feeling their joints and feeling their body to see if they can figure out if they find any sources of chronic pain. And then you'll decide what to do from there. But I think one, being aware of where chronic pain shows up, the two most common places we just talked about, teeth and joints. And then two, being aware of what the signs of chronic pain look like. And that literally, this is the upsetting thing, it could be any sort of behavioral change that you see in your pet as they're getting older. But I mentioned the most common ones. Being aware of those two things are going to be really helpful for you.
And this is a big question. What would you say are the most common treatments for those kinds of symptoms that you're seeing?
So for teeth, I mean, the best thing you have to do for teeth is just get the dental done and get those rotten teeth out of their head. Like that's it. Just like get the rotten teeth out. Those are the best thing you could do. And doing those dentals periodically, even if you don't see one. And I saw a question here that was like, if my dog's teeth look clean and no symptoms or problems, do they still need such an excessive procedure? And I would say, Janet, yes, they absolutely do. Because we, just like for us, we need prophylactic dentals cleaning. And a lot of our dogs have gone years without it. So even if they look clean, there's no guarantee that there's nothing below the gum line going on. And the only way to really check that out is to get them in for that dental extractions is a surgical thing, like when we do that, but we do it very, very commonly in vet medicine. It's a very common procedure that we need to do. It's not a super extensive procedure, I would say, for doing the dental cleaning and x-rays. It could be actually a pretty quick, short procedure if there's not much for us to do in there, but it is worth a look in my opinion. So sorry, Carrie, what was the rest of the question you had?
So, like, I'm just thinking for like all of the joint related symptoms that you described, what are the top ways that we can help support them? People have asked about supplements, hydrotherapy. Librela was a big one that people were asking about. What are you seeing being effective with senior pets who are having mobility issues?
I think the most important thing, well, we know that keeping them nice and lean is really important. So watching their weight is going to be important. I think keeping them mobile for as long as possible. And I personally have a goal. It really depends on the senior because you're going to have some seniors that are in that 12 to 14 year range, like you were mentioning, that are Goldens, and they can't do this. But if I have a healthy senior, a 7-year-old dog, and they can do this, I usually aim for 45 to 60 minutes of walking a day with them. That's just like a benchmark for you guys. That's what I aim for, as long as they can handle that. Now, I typically split that up into 2 walks, but that's my rough goal for them. Okay. And so keeping them nice and mobile consistently throughout their life literally exercise is going to help ensure that they're mobile when they're age 12, 13, 14, if you do it consistently with them. I think the other things that you can do, I think certainly getting on a good joint supplement at the right time could be good as well. And I do think there are some, classically, we think about omega-3s as being a really good one, but you have to make sure you talk to your vet about how you do it, because one, if you ever add those on, you want to make sure you pick the right one. So like just a really easy one that I like is one called Pet Omega 3 from Nordic Naturals. They make a human one too, but I don't do their cod. They've got like a cod oil one. I don't do that one. I just do the Pet Omega-3 one. That one also has extra vitamin D in it. So I like the plain Pet Omega-3 one from them. And then if you ever add that on, you add that slowly on. But the big thing with Golden, I think, are predisposed to being a little overweight. And so the challenge when you're adding on a supplement like that can be that you can add on a bunch of calories with omega-3s if you're trying to reach that appropriate level for them. So you have to talk to your vet about doing it. And sometimes the best thing to do is get them on a prescription joint diet if you can, if you're noticing that. So if you know that your dog, for example, if they were diagnosed with hip dysplasia kind of earlier on, or they've had a limp kind of at one point and the limp's gone away, so you know that joint issues is likely going to continue to be an issue as they get older, because it likely will, you can ask about getting your dog onto a joint diet earlier on. So
that comes directly from the vet?
Yeah.
Okay.
Yeah. Yeah. So we've got prescription versions. So the really nice thing about prescription joint diets, there's really 2 types that I think about. There's one that is for joint support plus weight loss, and then just like joint support and like they can maintain their weight. Like they don't need to lose weight. There's are 2 kinds I think about. But the nice thing about the prescription versions is that they actually have very high levels of omega-3s already in the food, so that you don't have to do a lot of extra supplementation with it. So you don't have to be adding tons of calories on it. And that is something that a lot of the over-the-counter joint diets, even though I still think some are reasonable and good, a lot of the over-the-counter joint diets don't have that extreme high level of omega-3s in them. So, but yeah, you'd get that at your vet, you talk to them about it and be like, I want to support their joints as they get older. Is this something I can consider or for them? Or, and I would only do it with dogs I think are predisposed to the joint issues, but I think that could be really helpful for them.
So many are. So that's, I hadn't heard of this either.
Yeah.
Yeah, new news.
Yeah.
And I'm wondering, as long as we are real quick, I'm trying to keep, I want to make sure we address all those things you've just said.
So many things to say.
But I've seen you post about the importance of protein in senior dogs, and also that when we do a body condition score evaluation, that we are considering muscle mass, because it's not, and I have seen this in our senior Goldens. I remember our Moses, he was in the weight category that a Golden should be in, because that helps support the proper structure of a Golden, 65 to 75 pounds for males. But his back end was really muscular. And boy, he hit about 12 and all that muscle began to dissipate.
Yeah.
Hydrotherapy. But I really saw a quick decline in his muscle mass. And so I saw you recently post about the importance of evaluating muscle, not just weight. So I'm wondering if you can comment on that and protein in the diet.
Yeah, it's really interesting. So when I think about diets for senior dogs, the very first thing that I think about is, okay, what disease do they currently have, or are they prone to, that I can use diet to help support them? So that's the overlying premise that you come in with. Then, so a lot of diets with senior dogs end up being just focused on supporting whatever disease they have. So like kidney disease, for example, they've got early kidney disease, our diet choice, depending on what level they're at, might be focused on kind of supporting those kidneys. Now, if you have a healthy senior dog or healthy dog that's getting older, one of the interesting things is that seniors do have an increased need for protein. They just have higher needs because they've got more muscle mass loss. They tend to need about 50% more protein than our adult dogs in order to maintain that muscle mass. And so there will be, just so you guys know, there will be nutritionists that disagree with me. There'll be rehab vets that will agree. There will be a kind of a little mix, but in general, one of the ones that you'll hear a lot of rehab vets talk about is they talk about a goal of having like 75 grams per 1,000 kilocalories if they're at a healthy weight. And then if they need weight loss, it goes a little bit higher for that protein needs that they have. And so seniors in general have higher protein needs. Now, the thing that would prevent me from doing those higher proteins are going to be if they have a disease like kidney disease or something else that might require us to be a little bit more selective about the proteins that we're using with them and more intentional with how we're supporting the kidneys, or a different disease that might require us to focus on something else. Like someone had a question about their dog having delayed gastric emptying and they were on a hydrolyzed protein diet, right? Well, that dog, we just need to focus on keeping that GI tract really healthy and emptying appropriately and keeping that aspect controlled. So we might not be able to hit the protein goals as much as we want with them. But we could certainly talk about it once we get that disease, controlled and see if there's an option or not for that. But in general, you do want them to have higher protein, or I would say moderately high protein diets is how I think about it, if they can tolerate it. But I also think it's important if you are trying to do that, I do think it's important to be keeping up with blood work with them annually to make sure that you're checking things like their kidneys and make sure that we don't need to be pivoting to something different for them.
Right. That's what I was just going to ask is, we're having a very general conversation about general principles, not a specific dog. So for everybody who's hearing that and is thinking, oh, I need to increase the protein my senior's getting, this isn't just randomly do it on your own. Do this in conjunction with your vet, with blood work to make sure that you're doing what your particular dog needs.
Exactly. Don't go out and just get a moderately high protein diet all of a sudden and switch them to it because of what you heard here. Sorry. To be clear.
General principles here.
Okay. In general. Yeah.
And then when you're talking about evaluating a dog's muscle mass, where would you check that on a dog?
The easiest place for me, at least, and it's hard with Goldens because they're so hairy. They've got so much fur all over them, but the easiest place is their back legs, in my opinion. And then also along their back. So their back muscles will start to, their backbone will start to palpate a little bit more easily to you, or feel it a little bit more easier when they start losing muscle mass. They've got really thick muscles right back there, but those are the places I tend to see it the most.
Okay.
That muscle mass changes. Yeah.
Do we have any questions we need to catch up on here before we move?
I don't think so, because sometimes, gosh, I feel like I wish we could go over every single one.
Yeah.
And sometimes they're so specific that we know, hey, we only have like another 20-ish minutes left. So we're going to have to hit some other things. But I mean, that's one of the other things that I want to make sure, and maybe we can do this at the very end, is make sure that you get your information out there about all of your resources, because I benefited greatly from some of even the free resources that you offer of like end of life, quality of life of your dog, information about arthritis. Like these are some resources you have, and I know you have something coming up. So I apologize to everyone that when you're asking really, really specific questions. We just can't get to all of them. Yeah. So we're going to probably just kind of keep going, but I'm not ignoring you.
Yeah. Well, and we want to pivot too, because there's this whole other side. I mean, there's both. There's the care and the wellness and trying to get as much longevity as we can with our senior pets, but then also recognizing there were a lot of questions about how do you know, right? I mean, that's like the bottom. How do you know when to shift to palliative care rather than continuing to try and do medical intervention? How do you know? That's the question that so many ask. And I think, for those of you that don't know, she has a box of Kleenex because we just knew we were going to need it.
I was going to go like this for the rest of the time.
Yeah, Aly went through this with her boy Wyatt, and she's referenced this on prior podcasts, but about a month ago. And so I'll let you fill in as needed.
But we want to hear from you.
There's a lot of anticipatory grief.
Yeah.
In young dogs, even anticipatory grief in a senior dog, and at the stage where that you're going to have to make the decision to euthanize. Yeah. So let's transition to that, because you did co-found Pet Loss Community. Yeah. I repost you guys all the time because you have so many fantastic resources on there. But when people say to you, how do I make this decision? How do I know? What are some guiding principles on that decision?
So we're talking about end of life decisions with our beloved pets and trying to understand when is the best time to say goodbye with them. And that's a very, very challenging decision. And it's very individual to each pet. Some guiding principles that I would say that I think can be really helpful are one, to lean into your quality of life scales. My favorite is actually from Lap of Love. It's the Lap of Love quality of life scale. It's free. Literally just Google it online and download it and fill it out and to kind of keep track of it. And it'll give you a good idea through a series of questions about where your dog's quality of life is. And the big thing with quality of life that's to me is that there's a big gray zone for a lot of animals. So there's a time where we know their quality of life is good. And then there's a scale where it kind of goes through this like gray zone where it's like it could be time, it could not be time before it goes below here. And the problem that we have is this gray zone is when we're in the gray zone, we're like, okay, so is this a yes or is this a no? Like, what do we do here? And a lot of animals will, because of your extreme love and care and your TLC, they will kind of hang on in the gray zone for a long time. And so you're kind of navigating this thing where you're struggling because you've got a little win, you've got two steps back and some losses, a little win. And so I think it's that gray zone that really gets people. And I think things that help are the quality of life scales. As I mentioned, Lap of Love is my favorite. I think documenting the 3 things that your animal loves to do and assessing whether or not they can still do those things to some capacity. It looks different. Like Becca, my 18-and-a-half-year-old dog, she loved to eat and she ate, heartily all the way through the very end. She also loved to go for walks. And towards the end, she started not wanting to go for walks. And that was kind of a sign for us, right? She loved it when we got home. And even when she was 18 years old and had horrible hips, she would still get herself up and walk over to see us when we get home. She couldn't hear us come through the door, but if she smelled us or saw us, she would get up and her tail would be wagging and she'd come walk over to come see us. So you think about the 3 things that they love, whatever those 3 things are, and can they still do those things to a certain degree? And then after that, I think that certainly leaning into your veterinary team or having a constant talking to them about it, because they're going to be the ones that see them all the time as well and can give you a good idea of if it's okay to say goodbye at this time or not, can be really helpful. I have like a free quality of life reflection guide that kind of gets you some things to think about for that if you're struggling with that. And then I have a $27 mini course where I talk about all these different things in depth that'll give you more insight, because I do think there are different types of goodbyes that can come for us with our pets. There's the shock one that adds almost insult to injury when it happens because you just weren't expecting, you weren't ready. There is a slow decline, where that was what Becca had. She had like a liver tumor pop up at age 15. And then we had seizures start at age 16 and a half. And every single time she just kept going. She just kept wanting to be here and doing her thing. We were like, okay, Becca, like we want you here too. So by 18 and a half, every single year at New Year's, we'd be like, oh my God, we still have her.
Yeah.
And it's amazing, right? But that's a long time to be like, we're going to lose her at any time. That's
You're in
years.
the gray zone.
Yeah.
Gray zone for 4 years.
Well, and I think, you thought, oh, maybe we're here. And then you went to the vet and got some pain relief for him.
Yes.
Yeah.
Yeah. And yeah, it's like I was telling Carrie, it's like wearing a weighted vest all the time. Like, it's coming, it's coming, it's coming.
Yeah, that's what it feels like. Actually, it's a really good description of it. It literally feels like that. Something on your chest, like an elephant on your chest with it. Yeah.
Yeah.
So those are the things I think it can help, certainly. And if you're struggling with that, I'm really sorry. We also have, Pet Loss Community, we have some resources and group support and one-on-one support for anyone that's struggling with losing a pet, because it feels so alone. It just feels like there's something so isolating about it. Even if you have people sending you flowers or asking you about it, I feel like you get a lot of support those first few days, that first week or so. And then it's week 3, week 4 come and people are scared to ask you about it because they don't want to make you cry. And then they or they can see you just trying to get through your day. And they're like, if I bring this up, this will just tear them down. And so then it's just this hard, I think, thing. And so I think certainly leaning into support and understand that you're so not alone. And there are people that care so much about people that understand that losing a pet for a lot of us is worse than losing a human for many of us. Because they're our little angel that was next to us this entire time, and more than like your mom, more than your dad, more than your best friend, more than your significant other sometimes. Like they're just with you all the time. Right. And not having them is just devastating. So I'm so sorry, Aly, for your loss of Wyatt. And
yeah, we were just talking the other day. So Aly and our friend Christy and I we do Snapchat for old people on this app called Marco Polo, where we do these chats back and forth.
Yeah.
And we were talking on Marco Polo the other day, and I said, where are we with Wyatt? And she said, it's been a month. I'm like, a month? You mean yesterday?
Yeah.
Because, every day just feels like
a few hours ago.
You mean like just now?
Yeah.
Like,
Yeah.
And it's, so I'm wondering, because, it's tough. So to the degree that you want to share, because I know a lot of people want to know, a lot of people, they love you and they want to know what happened, how'd you decide, how did you tap into these resources, right? Like all the things that helped you through, because there's somebody watching going,
that's probably
I don't feel like I can do this.
I can do it.
Yeah.
Well, and you were so helpful. Your resources really were.
Yeah.
It, especially about quality of life and watching it and knowing. And I think my friends were helpful too, because I think there's a piece of me that wanted to be in denial. Like even that morning, I'd taken him to the vet because he was running a fever.
And he didn't eat.
And he didn't eat.
And he didn't get up to come see you.
That's the other thing is that, well, when we got home, I go out to water the plants. Like this is my Velcro dog. I'm his sheep. He is on me like white on rice. He never leaves me. He's in the shower with me practically, literally. So I opened the door to go water the flowers and he stood by the door. I thought, what? And then he didn't eat his breakfast. What? He didn't eat lunch, his dinner last night. Wait, what is going on? That's 2000 never. So it's like, these are the things. And I took him to the vet and the vet is looking at me like, this is it, Aly. And I'm going, no. But what medicine can you give me? And he's like, and he had really giant, overnight, almost swollen lymph nodes in his neck, in his armpits.
Yeah.
But there were things, and they're like, this looks like lymphoma, and it looks like this is it. And his heart was starting to fill up with fluid. His lungs were starting to fill up with fluid. He had a heart murmur. He was shutting down. And I am so fortunate that I have good friends going, yes, Aly, you're making the right decision, because there's a part of you that feels like, but I don't want to end their life too soon. And am I just overreacting and being dramatic? But what if I could get one more day?
Heroic effort could we make?
Yeah. What if the medicine will work? And what if I could just get a little bit more time? And I think it's a personal decision. And I'm not saying that it is this way for everybody, but for me, I knew even the week before I gave him a bath, and in that bath I went, I think this is his last bath.
Yeah.
Like there's that knowing that we have that sometimes we don't want to listen to. And so fortunately we used at-home euthanasia. There's a place local called Coda Pet. And I am so thankful. And I think that this is part of it, is there's dignity in it for you and your whole family and your animal. And to anyone that's wondering, I've talked to a lot of people since this loss, and they're saying, oh my gosh, we were at the vet and it was so much harder at the vet than it was at home. And if we wish we could have done it again, it would not be in this very big, dramatic, chaotic crisis. Yeah. And that's what, if I can speak to any of that, is that, I got to lay on the floor with my face like this. And all my kids and their friends, because this has been, not only has it been my dog, but it's, all of my kids' friends. And so I've got all these young adults in my house, and everyone is, gathered around and feeding him Cheez-Its. He ate Cheez-Its to the very end, I've been really good about keeping his weight healthy and exercise and all the things, right? But yeah, on your last day, let's go get a pup cup and you want the inside of my ice cream bowl? Actually, it probably lasts a couple months. Yeah. You could just pretty much have anything you want, because I knew it was coming. Yeah. So just being able to, all of us, to speak loving to him, and having that in-home person who was so patient and took their time with us and explained everything they were doing. And it was the best, worst day. It really was. Yeah. And even afterward, for whatever reason, it was really important for me to carry him out of the house. She said I could bring a stretcher in and we can put him there. And I just know I need to hold him. I need to wrap him up in his favorite blanket, because Wyatt loved blankets. We called him a blanket, UHORE. That's what his nickname was amongst my adult children, who would they go, no, he's on my blanket, and then I'm like, well, you're the one that left it there. So it was important for me to wrap him up and carry him out. And she helped me with that. Even when she's laying him in the back of her car, she's tucking him in. I just 5 stars. So if you're wondering and you're thinking, is it too soon? If I can give any advice, is I'm so thankful we had that goodbye instead of something chaotic and crisis at a vet clinic with people I don't know that are just trying to get us through it. I'm not saying anything bad about that, but I just want to say that was the best thing. So thank you for your kindness,
Yeah.
everyone. I appreciate it. And I think some of your information, even some of the things you have on Instagram, really helped me consider what's his quality of life, not mine, and putting
Yeah.
dignity in his, because
Yeah.
he's leaning on me for that,
Yeah.
and it's not that I wouldn't have chosen that or people won't think that, but I think there's a level of denial that's involved, and that those things you have posted, a lot of the stuff that I've watched you on your post on Instagram helped me overcome my denial and start thinking about what is his quality of life
Yeah.
and what's my responsibility.
Yeah.
So
Good. Well, I'm so sorry. I mean, I'm so glad you had that type of goodbye with him because we don't always get that. And I do, I'm thankful that the things that I've done online have helped you in any capacity and anyone in any capacity because it's a really hard topic and we don't talk about it enough. We're really death averse to speaking about it, but I think it's just so important because it just, if we don't talk about it, how will we know? And you'll just be shocked and surprised and you won't be prepared. You won't be able to have created a beautiful goodbye like that for him. And so yeah. And I think I'm seeing there's a lot of people in the comments here, by the way, that are saying, thank you for sharing that with us, Aly. And someone had an at-home euthanasia and said with Luke in his favorite field where he would roam, which is beautiful, like Leanne. And I was gonna mention one thing is that I also prefer at-home euthanasia if I can do it. I always tell people that there may be a situation where the best thing for them may be that you have to say goodbye at the vet clinic. So they're in congested, like I had to do this with Orwell. I don't know if you guys have been following me since I had Orwell. Orwell was like my like little soul dog. Like he was everything to me. And he had a really bad heart. I adopted him at age 12. He was this little Chinese crested powder puff that would chase me around with a tennis ball all day and never let me work. And I just loved him so much. And he had congestive heart failure. The second time he went into congestive heart failure, I took him to the ER and we were there for hours and he was not responding to the treatment to get the fluid out of his lungs. And I just knew I was going to either let him basically drown to death, which is what could happen with congestive heart failure, or I was going to have to say goodbye to him. And he's in an oxygen chamber, taking him home because I wanted to go have an at-home euthanasia later because I loved that was what I wanted to create, was not the best thing for him at that time. Right. So for him in that situation, the best situation was for me to take him out and immediately humanely euthanize him in their quiet room together with him in my arms. But man, do I wish I could have created that event, the at home, the peaceful thing that I had with Becca, the peaceful thing that I had more with Frodo, my Westie that I told you guys about at the beginning. But I agree that if it's reasonable to do and you can do it, then yeah, I think at home is definitely better. And then, and it depends on the dog. It's funny because I'll say that and then people will be like, but they like going to the vet. Like they're their social butterfly and that's like their favorite place. I'm like, okay, well, if that's their favorite place, then bring them to the vet. We will surround.
so
Yeah, it's so personal. Exactly.
One
So
thing I don't want to, because we are just about out of time, and I want to give people this gift of permission to grieve.
yeah.
Two things on that. One is there was a recent podcast with a gigantic following, and the messaging was basically, don't cry when you're saying goodbye to your dog.
So
Make it a celebration for them. Don't cry. And I find that to be harmful messaging.
yeah.
It's on such a huge platform that I know some people have watched it. And people DM me a year, a decade after they said goodbye to their dog, and they are still train wrecked over it.
Oh yeah.
I feel like they should be past it. And I want to give people permission to cry, and I want to give people permission to grieve as the rest of their life. I mean, like that's what we do. So if you can just talk about like the healthy grieving process with dogs.
Yeah, I mean, just to mention, like I've done hundreds of at-home euthanasias because I used to work part-time for a company that did that too, and of course most of my time is in clinics. But regardless, I mean, if you're crying, just cry. Like I think it's emotionally healthy to be where you're at. I think I understand the sentiment of trying to make it about celebrating life, and I think that that's good. But it's okay to also be like, this is sad. Like I'm losing my best friend. Like that's okay to recognize and that's okay to feel that. And I think the only time where I say that you want to be mindful of your emotions is if your emotions are maybe preventing you from focusing on what's really happening with the pet and like when to say goodbye, right? Or like they take over from they which they will cloud your judgment to a certain degree because you're ultimately extremely biased with this pet and you're extremely attached to them. But I think that you should be able to feel emotions. And I would say probably 90% of the ones that I'm in, people are crying. How can I'm crying at all of them. So
Yeah.
please feel all your emotions, and grief lasts. There's no timeline on it. I'm still grieving Becca. I'm still grieving Orwell, who I lost 2.5 years ago, like deeply. And I think the thing about grief is not trying to feel it. I think you should be feeling your grief. That's just what the love that you felt. But I think understanding that, at least for me, and you guys can tell me how it works for you, but grief transforms me. Like it transforms me into being a better person eventually. Like it hurts like hell. It's like one of those parts of life that like is like the most devastating pieces of life that throws you on the floor and you feel like you can't get up. And then once you start kind of navigating through it, even though you never ever have wanted to go through that loss, I think that it can eventually transform you into someone that's stronger, more empathetic, more kind, more thoughtful, more aware of people and the situations they're going through. I think that's one of the gifts in addition to having the most amazing creatures that you got to spend some time with. But no, I don't think that you have to make it a celebration. If you can, and that's something that you can do, I think that's fantastic, but I don't think that should be the expectation. I don't think that's healthy.
I completely agree. And grief is the price we pay for love.
It is.
But it also is a gift. It's been a gift in our friendship. And it's beautiful.
Yeah. Yeah, I agree.
So, okay, well, we could talk to you for forever.
Yeah.
I hope you'll come back.
I'd love to come back.
Conversation. This was amazing.
Thank you so much.
Of course.
Honestly, I mean, just on behalf of everybody, you, I'm sure, have very little visibility into the massive impact you've had on those of us who have been left by a dog.
What about her? I think she has the early bird pricing
yes,
coming up.
yes, please share all the places because you have a senior coming up, and I want you to comment on that and early bird pricing and where people can find you.
Well, so if you guys don't know, so number one, thank you so much for having me. It's just a privilege. And I'm actually really grateful I could spend this time with both of you, but also everyone here in the chat that have been here the whole time. Like, thank you for your great questions. Sorry I couldn't get to all of them. If you guys have me back, I'm happy to go through more and talk more about it. We have a really exciting event in September that I think every single person that has owned a senior dog or owns one currently should be at, where we are going to be doing a deep dive into learning better ways to help our seniors. It's Saturday, September 12th. It is virtual. You can literally be sitting next to your senior pet on your couch at it the entire day. I'll be there speaking that day, but I've collected a bunch of experts that I love and admire that'll be coming and talking about different things. We have a talk about how to massage your senior dog at home, so you kind of can learn how to keep them comfortable. You've got a talk about chronic pain. We've got talks about home cook along. If you want to do a home cook along with us, we've got Nikki, who's my friend, doing we'll tell you the recipe, the items, the ingredients to get it ahead of time. You can kind of cook along with her for an hour. We've got talks about healthy aging in dogs, what that looks like, about longevity in dogs, about things to be aware of, about chronic pain in them, all these things. It's just 6 hours on a Saturday. You've got 2 different channels that you can pick from. And then we've also got really cool, fun, like awards and contests. So we'll have like Toothless Wonder, voting and submissions for your seniors if you want to put them in there. We'll have like RBF, like best senior dog RBF. You guys get to submit. We've got crustiest old dog that you can submit. So like a bunch of like fun contests stuff. We're going to make it a really fun event, but we'd love to have all of you guys there. In fact, I think every single pet parent out there that has a senior or plans to have a senior or has had one should come to it. We have a special code this weekend only. It's $29 when you use the code. It's VIP. Yeah. The code is VIP. I mean, like it's super underpriced, but like we just want people there to learn. That's it. And we've got so many cool talks and stuff too.
So seniorpetcon.com is where you register, and the code is VIP.
Okay.
So you have Senior Day coming. Your Instagram account is Senior Dog Doc. So that's Senior Dog DOC as in Charlie.
Yes.
And Pet Loss Community is a separate Instagram account. Pet Loss Community is just a wonderful account. I feel like I just know like, okay, I'm going to go to Pet Loss Community now. And I'm just going to, it's like, I want a cup of tea and I just want to breathe and listen to classical music and watch Pet Loss Community. It's very restorative. I love that account.
Thank you.
And then any other resources or anything else we should know about?
I mean, there's so many I want to give you guys. It depends on the struggle that you're having, but if you're looking for a vet that's taking additional geriatric training every year, seniordogvets.com. If you want to come join us and learn more about helping your senior pet and just have like a good time with other people that own seniors, come to Senior Pet Con. And then follow me. I've got a bunch of things online, and I think that's it
Do you
for
have a
now.
Substack?
I don't. No, no.
We
Should
need to
I?
get you on Substack. We need to get you on Substack. This was a question people had. Do you do phone consults?
Not at this time. The big thing that I do is I have a small group program that I do with pet parents where I help people basically like build out their seniors plan, how to help them age well, things that matter to that senior. And it's a really fun program. It's called Glow Up. I tell people, like, if you want to work closely with me and have me know your dog, join Glow Up because we spend 7 weeks together. You get access to a lot of my trainings. You get to learn how to build out your senior pet's happiness, wellness, and end of life plan, which I think are all really important for them, no matter where they're at. And it's just a fun program.
Okay.
Yeah.
Well, we will let you go then. And thank you again.
Yeah.
So much. Thank you. And thank
Well,
you to
thanks.
everyone who came.
Yes.
Yeah. Thanks for having me, guys, ladies. I
All right.
appreciate it. And have a good day, everybody.